Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Hechler.
And I'm Tandi Hechler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. Hey, everybody. Welcome to Rev Up Health. And so today we're going to have a topic of discussion that is certainly something that should be on everybody's mind, and certainly that all of us are exposed to. No matter what level you think you are health-wise, we are all exposed to it. And one giant word for today's podcast is inflammation. So today, inflammation is going to be a goal that we will try to get you all educated and make you more aware of the fact that, there's a lot of things that maybe are causing inflammation in my system, or maybe, I'm having these symptoms and I'm having that as a result of inflammation. So I certainly think that's something that everybody has. And as you'll find out today, hopefully it will get you a little more aware, and maybe you can make some changes in your own life. But, let's first by kind of defining what inflammation really is. The Institute for Functional Medicine basically says inflammation in the body is a complex biological response to what they call harmful stimuli. These things can be pathogens, which causes damaged cells, and you can have also toxic compounds which cause the inflammation to occur. But it's a protective mechanism.
Yes. So inflammation is not all bad. We really do need acute inflammatory response to help us fight disease, heal when we have an injury. Acute inflammation is necessary and needed. So some things that characterize acute inflammation would be heat, redness, swelling, pain, function, potentially.
Yeah. It's basically inflammation. It's a protective mechanism. It involves our immune cells and blood vessels and little mediators that they all have to work together. And they try to eliminate this initial cause of this harmful cellular stimuli. And we try to clear out the necrotic cells. We try to clear out, damaged tissues from this original insult, and then basically promote repair. So the acute inflammation is absolutely that, Tandi. Yeah, we definitely want to repair.
Right. So chronic inflammation, on the other hand, is the opposite of acute. It's inflammation that hangs around.
Right. Prolonged. Basically prolonged stimuli, but that's something that leads to a prolonged inflammatory response. And then, these symptoms can be something like fatigue or pain, digestive problems, mental health issues, weight changes, of course. Those can be something that's seen with chronic inflammatory process. But typically, metabolic changes are drastically affected, which happens throughout all our systems often, obviously, throughout the day. So it's certainly something that occurs. This is kind of a less intense, not like an acute, sudden injury, but it's more of a less intense, more persistent type of inflammation. And it can last for years.
Yes, subtle. It's just a low-lying inflammatory response.
Yeah. But yeah, it's certainly something that causes the presence of these immune cells like macrophages and lymphocytes to influx. And that creates this chronic, scarred up inflammatory process, months, years, decades. So it can be something it's chronic in nature. And, this is the type that's associated with chronic diseases, specifically like autoimmune diseases, cardiovascular diseases, neurodegenerative problems, diabetes, cancer, COPD. Those things are a chronic inflammatory response. And
right. Neurodegenerative disease also falls in that category. I think when we're talking about inflammation, it's really important I really like how Dr. Mark Hyman talks about inflammation and how he calls it inflammate, because inflammation is such a big cause of aging in our body.
Yeah, dementia, Alzheimer's. Obviously, the Alzheimer's is becoming quite a common household term these days. So it certainly affects a lot of folks and is a result of a chronic inflammatory response. Essentially, those things aggravated. We have a lot more research to understand that, but it's certainly something that's the type 3 diabetes, as you probably have heard. So, but 50%, literally 50% of all deaths worldwide are related to these chronic inflammatory diseases. And 90% of all chronic illnesses are related to inflammation. So you can see it's a very widespread, very important thing to know what's causing it and what you can do to prevent that. So there's a lot of things we'll go through. So the causes, let's just start there.
Yeah. So you've got infection, bacterial infections, viruses, parasites, mold, toxicity. All of these things would cause us inflammation.
Right. And our diet and lifestyle, those are very, very important things. I mean, I think, what our nutrition and our lifestyle is the two main drivers of all chronic inflammation. Yes. I feel like.
I think included in lifestyle there is stress too, because stress is a big cause of chronic inflammation.
Yes, very much so. Exactly. So, but, the standard American diet is just awful. Here we are, 60 to 70% of our diet is made up of a standard American diet, which is just highly overprocessed foods, sugars and starches. This stuff is devoid of nutrition, and yet it stimulates more of addiction to want to have more of it. So it's certainly something that our own system knows what kind of macros we need in our body. And it's basically what we don't realize is that we're trying to obtain these nutrients, but yet we're continuing to eat. And so you don't get the nutrients, but you keep eating. And so this is the problems that start to happen. But lack of exercise is another huge one. I'm such a fan of any type of movement or exercise. Those things are very, very significant. So just any type of movement makes a difference daily. I think we've talked about this before too. It's not just necessarily going to the gym and working out and then go to your job and just sit all day long.
It's so important to incorporate small bouts of movement throughout the day.
Next on the list is environmental exposure. These toxic exposures to BPA, phthalates, PFAS, these types of things, which are you see with production of plastics. Essentially, that's something that we all have an exposure to, where they take home in your plastic, don't heat it up in the microwave, try not to drink out of plastic stuff, try not to eat out of plastic things, try not to make anything with plastic stuff. It's certainly something that will add up.
It's so good for me to hear this.
It's so hard to avoid that.
Because somebody used to have pretty bad habits around that. So
yeah, but I didn't know. Now we know, and now we're educating.
Yes. So true. And I do want to just take a minute to also say that this can get overwhelming. When you're hearing this information and taking this information in and learning these things, it can get so overwhelming and you can be like, oh my gosh, I can't do anything.
Small bites.
Yes.
You just got to take small bites because you can't do everything. You can't remember everything. And even if you know it, you're going to forget it. You just kind of have to revisit and think about things. It's really a continual process. And then, once it becomes more habit, then it's a lifestyle. And that's what we're talking about is a lifestyle change. Yes. So, but even the things that we get at the grocery stores, okay, let's say we go to the store and we get this nice whole food and these nice vegetables and apples and the meat at the deli, at the meat markets, but yet how are they raising it? Where does it come from? Is it sustainable grass-fed beef, for instance? Or is it free-ranging chickens? So the herbicides and these pesticides are pretty significantly overwhelming. And those things are significant endocrine disruptors and gut disruptors too.
Yeah.
So, but even something living in the cities, now you were talking about air pollution.
Sure. Yeah. So, and not to mention your water sources.
Right.
And, if you're getting city water,
filtering your water as good as you can. They may do all they can do to filter it, but there's limits, with lead and arsenic and things like that they have to allow it to be drank. But okay, well, let's just not have any of that. It's not normal to have that in your system, and we can test you to identify those types of things. So
yeah, sure.
But autoimmune conditions, the immune system just mistakenly attacks its own body. For instance, like in rheumatoid arthritis, Hashimoto's thyroiditis, and then you got celiac disease, MS, multiple sclerosis, And then polymyalgias, vasculitis, and even POTS disease. There's still a lot of information and studies needs to be done with that. But, postural orthostatic hypertensive and those types of things can be caused from your diet and lifestyle and exposures.
So oxidative stress is part of this chronic inflammation.
Yeah, it's something we see with atherosclerotic heart disease and diabetes. I mean, basically you have an imbalance of free radicals versus your antioxidants. So your antioxidants are trying to get rid of the free radicals, so that is not growing around and creating tissue damage, because that's the physiologic cause for atherosclerotic heart disease is that tissue damage. So, and that's all aggravated in these phospholipids in the cellular level of your arteries. And so that causes an influx of macrophages, which leads to foam cells, and that can lead to destruction and scarring. And that's how we hit the narrowing of the arteries. That's how we get the hypertensive problems too that occur. It's all this free radical stuff that happens. So it's certainly something that's very important. But oxidative stress, you can think of it as like rusty LDL cholesterol particles. That's essentially how you can think of it.
So there's several ways that we can identify chronic inflammation in the body. And some of the ones that we frequently test for, and we test for in our panel, would be C-reactive protein, the ANA, and rheumatoid arthritis factor.
Citrates, and citrate.
Yeah.
So, but we can also look at IL-6, but there's, the other option is stool cultures.
Yeah, stool cultures. There's food sensitivity testing. You can do heavy metal testing if, you're not finding answers. A really big one, because I have noticed just in speaking with patients recently how much valuable information they're getting from these food sensitivity tests. Removing some things that they didn't know were affecting them, and then once they remove it, they find out how much better that they can feel.
Sensitivity testing is not, people think, well, is it an allergy? Maybe, but it's not just an allergy. It doesn't have to be an allergy at all.
You can still be sensitive to something and not be truly allergic.
Right. But management. How do we manage this stuff? That's the important thing. Okay, we can identify the issues, the things that are causing us to have this inflammation, but how do we manage that? First on the list is diet. We have to adopt a good anti-inflammatory diet, which is just rich in fruits and multicolored vegetables, even the cruciferous vegetables like broccoli, cauliflower, Brussels sprouts. Exactly. Those things are great for an anti-inflammatory. It's a glutathione maintenance thing that we can create also to help improve our inflammatory glutathione. Glutathione is very important for anti-inflammatory process with our system.
Healthy fats are really important there too. So you're talking about, olive oil, avocado oil, avocados themselves, coconut oil. Good old
omega-3s. That's a big thing.
Yeah.
And then lean protein. Lean protein is good from a reasonable source. It's certainly something that when we talk about avoiding chemical exposures, we want to have a good protein source.
So the Mediterranean diet gets talked a lot about. Mm-hmm. That includes all those things that we just spoke about, including some fish, sardines.
Studies have been shown that you can reduce your C-reactive protein, which is an inflammatory marker that we can test. You can reduce that by 20%, just by having a good diet. So It makes a big difference. We really want to increase fiber.
Yeah.
Fiber is a huge player also in our diet. And I think that the 35 grams of fiber in a diet is probably not enough, because our bacteria really like that.
Yes.
That fiber gets processed in our gut, and that helps to control our inflammatory markers and produce things that help to fight inflammation and antioxidants. But it'll just help to optimize our gut microbe. I always like to talk about the GADS elimination diet. We got to get the gluten out of your system. We got to get the alcohol away. Stay away from the alcohol as much as you can, which is really hard to do sometimes, especially when you get to events. Dairy products, and then sugars and starches. If you kind of remember that mnemonic, GADS elimination, if you try to go to the store and shop from that line of thought, and I think you're going to help to reduce the inflammatory process. I can't tell you how many times that I've seen children, babies, in the clinic that have come in to see us, and the kiddo's having a runny, snotty, congested nose, and okay, well, here's another antihistamine, or here's a nasal spray. They've had all these things, but take the dairy, take the gluten out of their diet, and it clears. And it doesn't take long to clear it. We see these things improve almost instantly from that standpoint, but you certainly see a big improvement. And when I do recheck kids, they're literally doing much better.
Yeah. And this GADS diet is very similar to Whole30. So if you're familiar with the Whole30 diet, essentially the same.
Yeah.
But an elimination diet. And probably we need to do a separate podcast on what that looks like and kind of help people understand what the steps are to really implement an elimination diet and then work through adding things back in.
But avoiding a lot of things, obviously things that are endotoxic, endocrine disruptors, these BPAs, the PFASs, the phthalates, all that stuff in the neuroplastics, and the herbicides and the pesticides. They're just laden with chemicals that are forever chemicals. For instance, the PFAS are just forever chemicals that once they get in your system, they don't go away. And that creates a chronic toxic exposure. Your liver can only do so much to detoxify you. It can regenerate itself nicely, but it needs some help. And the more we can avoid, the better we can help things out from that detoxing standpoint.
And just remember, not getting overwhelmed and small bites. Like everything that you can do, like even if it's not half the things we talk about, anything that you can do is helping to move you in the right direction. So just remember that. I feel like a lot of times people can get so overwhelmed and just be like, forget it. I'm not even going to go there because it's too much.
Right. It gets overwhelming. True. Yeah. And it's also nice to have, we talked about this already in another podcast too, about community, about, having help, someone to help you through this and navigate you through what you need to do to help modify your life, your eating, your lifestyle.
An accountability partner.
Yes, absolutely. Lifestyle modifications, essentially that's another big thing, regular physical exercise. Studies show that you can reduce that CRP again by 35% with just a regular 12-week exercise program. I mean, that's pretty significant. But the key is consistent, regular exercise. It doesn't have to, you don't have to go out and run a 5K or a 10K all the time. Just getting out and move. 20 or 30 minutes of physical activity or vigorous walking will very easily suffice.
Yes. Stress management is another piece. So meditation, just practicing mindfulness will really help to reduce that stress. And adequate sleep will also help. We know that we need 7 to 8 hours of sleep per night.
Yeah, there's a lot happening when we sleep. The body is repairing and remodeling and getting rid of all the bad stuff we've done all day long. And that's something to be very helpful to get that good sleep. Exactly. So supplements, what supplements can we do to help remove inflammation? This is just a piece of the puzzle. There's a lot of stuff out there, but obviously there's, supplements that are known to have anti-inflammatory properties like curcumin, omega-3s. So that's a pretty significant reduction by just picking up a few supplements that you could do on a regular basis. There's resveratrol and of course there's the antioxidants, vitamin C and E. Those also, and glutathione.
Another thing that can help with inflammation is hormone optimization. That's not just talking about your sex hormones. We're talking about thyroid, testosterone, estrogen, progesterone, DHEA, vitamin D.
Optimizing those. And it doesn't necessarily mean that, okay, I've had these tested, they're all in normal range. Normal is not optimal. So anything you can do to help optimize your hormonal levels will help improve and reduce your inflammatory response.
Yeah. And then obviously medications. I think this is something that a lot of times people think, oh, holistic medicine doesn't believe in medications. And it's very important to know that sometimes your body needs medications to help you get to a place where you can make the modifications in your nutrition and your lifestyle. And then you may not need that medication.
You may be on the medications now. You may be on the pharmaceuticals because you didn't know anything else. You weren't told that. You were given a prescription for a medication to take. That's great. That will work. But let's try to do some other things to, number one, either reduce the medication or just eliminate the medication. Yes. So there's side effects that come with medication. And, I think at Revelation Health and Wellbeing, I think our big emphasis is on really allowing your own system to right the ship, to stay afloat and pull, chug straight ahead. So that's something that I think we do quite strongly to help people navigate their health.
Yep, I agree.
So, but reach out to us if you have any other topics. We hope you had a little bit of information here and didn't get too overwhelmed. Like Tandi says, take small bites and try to do a few things. Just start implementing a few things.
Yeah.
Come back and visit the podcast. Follow us along at Rev Up Health. We'll have other podcasts with very similar things and ideas that you can do. Until then, have a healthy day.
Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.